So I want to follow up on something that deserves to be taken seriously without causing panic. This is also answer to patient of the day. So postmenopausal bleeding is not something we ignore, okay? It is also not something that we catastrophize. So if you have bleeding after menopause, which means you've been 12 months without a period, that workup always needs to happen. That usually is going to start with something like an ultrasound. We're going to look at what's called your uterine lining or your endometrial stripe. Sometimes it's going to include an endometrial biopsy, and the goal is to rule out serious causes and not just to assume the worst. Most of the time, the cause of the bleeding is benign. Most of the time, it's things like vaginal atrophy, uterine polyps, or even hormone related changes, especially if you've changed your menopause hormone treatment recently. The key takeaway is that you have to have it evaluated though. You cannot just reassure without evaluation. And if you do, it's really just a missed opportunity for an early diagnosis of something, which is when treatment is normally the simplest and outcomes are usually the best. So, this is what taking symptoms seriously looks like. Not fear, not dismissal, just good medicine.